Peptic ulcer disease is one of the most common conditions that is surfacing in health facilities. Now, what has brought me to speak about it is the eating modality. What are you supposed to eat? What are you not supposed to eat? How does eating help you in treating peptic ulcer disease? Does eating have something to do with the ulcers? Yes, this is going to be an interesting video. How does eating affect peptic ulcer disease? And how has your lifestyle failed you from healing from peptic ulcer disease? So now let's discuss the peptic ulcer feeding modalities. But briefly, let me begin with a very simple pathophysiology for stomach and duodenal ulcers occur when the mucosal defense is weakened and the acid or pepsin damage the lining of the stomach. And the factors which do this are 1. Helicobacter pylori, which is the major cause of peptic ulcer disease, the NSAIDs, which damage the protective linings, excessive gastric acids, which worsen the ulcers, lifestyle factors like alcohol and smoking. So now the goal of dietary management is 1. Reduce irritants, promote healing, and lastly, prevent recurrence. So number 3, now what are the general feeding principles in people with peptic ulcer disease? 1. Eating small, frequent meals, that is 4 to 6 smaller meals instead of the 3 heavy meals of the day. Avoid longer periods of fasting. 2. Maintain a balanced diet. Now this is where people want more. Foods to prefer in patients with peptic ulcer disease. I'm going to give you examples, categories, and even benefits of these foods that I'm going to mention. The best foods you would prefer when you have peptic ulcer disease. 1 are the proteins. What are the examples of proteins? Which diet can we get proteins from? Lean meat, fish, eggs, low-fat dairy. Why? Proteins promote mucosal repair of the gut. Another type of food is carbohydrates. That is rice, oatmeal, pasta, and bread. These ones are non-irritating and provide energy. Another one is vegetables. For example, carrot, spinach, zucchini, pumpkin. These ones are very gentle on the stomach. Another thing to consider are fibers. And another one is selected fruits. For example, papaya, melons, and peeled apples. These ones are less acidic and promote healing. Another ones are these useful fats. For example, olive oil, small amount of nuts. They have anti-inflammatory properties in moderate. Another thing to consider are fluids. Water, herbal teas, for example, chamomile. However, keep a food diary to track which foods trigger symptoms because tolerance can vary among patients. Then avoid the following foods, and the reason is why. 1. Spicy foods. This may irritate ulcers and exacerbate symptoms. Avoid acidic foods, that is citrus fruits, tomato products. This can trigger symptoms. Avoid coffee and caffeine. This increase gastric acid secretion. Avoid carbonated drinks because bloating may worsen reflux and discomfort. Avoid chocolate. Chocolate contains caffeine and theobromine, which may increase acid. Avoid fried and fatty foods. Avoid alcohol because it damages mucosal lining. Avoid smoking. It is not a food, but tobacco worsens ulcers and delays healing. Let me emphasize the issue of alcohol. Alcohol increases gastric acid and delays healing of the ulcers. However much you get the best treatment. Even moderate intake can exacerbate symptoms. So patients with ulcers should abstain completely from alcohols or 6. I'm also going to give you lifestyle considerations. Avoid drugs called NSAIDs. For example, aspirin, diclofenac, ibuprofen, indomethacin, mentioned but a few. If NSAIDs are necessary, consider always taking it with a PPI. Do stress management. The techniques you can use: medication, yoga breathing exercise, adequate sleep. Cease from smoking. Smoking slows healing and increases risk of recurrence. Another lifestyle is meal timing. Avoid late night heavy meals. Eat at least 2 to 3 hours before sleeping. Additional tips for patients with PUD. Avoid skipping meals. This prevents excess acid secretion. Maintain a healthy body mass index because obesity can worsen reflux. Keep a symptom diary. This is where you can note foods that can trigger symptoms and do regular follow-up with your doctor. This video has not changed your medication plan with your doctor. It is just modifying your eating modalities.